Welcome again to Mainline Healthy Living, where this month I'm introducing you to all different local experts and hearing a little bit about who they are and some of the things we'll be talking about in the future in future episodes. Today we have Hina Sheth. She is the owner and operator of Rebalance Physical Therapy and has some interesting specialties. So welcome to Mainline Healthy Living, Hina.
Thank you, Mark. I'm excited to be here. And I can't wait to kind of talk and engage with everyone that's subscribing to our site and just educate them and a lot of surprising things that many people don't know about.
Right. You're not a typical physical therapist in a lot of ways. You can do all the typical stuff, but you have some interesting specialties. So let's talk a little bit about the kinds of people that you work with.
Yep. So I help people who are suffering from all sorts of orthopedic issues, but mainly we see a lot of patients with low back, chronic sacroiliac joint pain, pelvic pain, as well as various types of hip gluteal pain that doesn't seem like it's quite going away. I help a lot of people, again, with low back sacroiliac joint pain that have had...
Pretty common, right?
Very common. It's one of the most common problems in the United States. And a lot of people are just taking needless medications and they're having to possibly think about surgical interventions that they don't want to have, or they've, had various types of other health professional interventions, and they necessarily haven't pinpointed or gotten to the cause of the issue behind what's going on. So we treat a lot of those patients.
Right.
The other types of people that we help are actually women who are silently suffering with vaginal pain and they can't have intercourse.
Right.
And it's a big problem because they're going to their gynecologist and they're trying to get help, but they're maybe not getting all the answers, or they're given maybe some creams or told to relax, or maybe it's in their head.
Right, you're stressed out.
You're stressed out.
Right.
It's not in your head. I mean, we treat women from 20s all the way up to their 80s that are having issues with intercourse. And it's sad because it's such a huge, it impacts their lifestyle.
Right, and people are uncomfortable talking about it, so they may not even clearly describe what's going on to their physician, and they may never, get help for years and years, and then suddenly they discover, hey, this is a muscle thing, right? I mean, this is, these complicated pelvic floor muscles.
Exactly, yeah, and it, sometimes it's very easy to treat, and sometimes there's a complex issue that's behind all of that, and so we're the people that kind of sequence their treatment and put it all together and help them find other practitioners that need to kind of collaborate with us to get these people going and to get them better and to get them having sex again. And
it's not just women, you were saying.
Not just women, yeah. We also treat men that are having, everything from rectal, prostate, testicular, scrotal pain. And again, they, it's embarrassing. They don't want to talk about it.
Right.
They go see their urologist, and they've been from urologist to urologist, and they've maybe been told that, oh, it's a case of prostatitis or some type of infection, and given antibiotics, and maybe it helped initially, but they're continuously having the pain. And, light bulb, it's not an infection. There's something else that's going on. And unfortunately, this is an area that many healthcare practitioners don't really understand how to treat.
I'm guessing a lot of people get no training whatsoever in this kind of stuff.
No, it's a very specialized area. And even within this specialty, you really have to have a good grasp and really like and love to treat clients that have these things going on. And we've been treating this for 15 plus years. So, we kind of know this area in and out. And so, that's, we definitely help men. And we hear that question all the time. Do you help men? And, there's a lot of them suffering out there, and they don't need to be, because there's a solution.
So part of it is getting people to know that you exist and that this specialty exists, and get them there sooner so they don't have years of frustration and discomfort and awkwardness and not realize that, there's actually a treatment for this kind of stuff.
Yep, exactly.
They probably leave your practice a lot more relieved than when they started.
I think so. There's a lot of questions that come out of there too. But yes, I think there's a big relief in people knowing that, wow, there's actually something that can be done about these things. And I had no idea. And every, from healthcare professionals such as physicians to even our own physical therapists within our own profession don't realize what could be done. And my goal is to educate everyone out there, professionals as well as people who are having these symptoms, because they don't need to be living with this type of pain.
Right, absolutely.
Yeah. So in addition to that, we help people that are having bladder pain as well. Bladder pain, urinary frequency, urgency. These patients know where every single bathroom is in every stadium.
It's very stressful.
Every highway. They're having to go to the bathroom every 10 to 15 minutes. It feels like a chronic urinary tract infection, but everything's turned out negative when they've had lab results done. And these are some of the things that we who specialize in
so
these
again,
types.
this can be a muscular thing that's actually causing
Yeah,
it.
this is a big muscular thing, and as we'll talk about in future episodes, the organs and the muscles talk to each other. And so it's kind of like one bad apple spoils the bunch. So the musculoskeletal system can
Easy
have,
for you to say.
easy for me to say, tongue twister, can have a huge impact on these types of symptoms that patients are having. And going along with that, we help women that are having, they're embarrassed to actually leave their home. They're fearful of leaving their home because they're having urinary incontinence.
Right.
And they are, it impacts their lifestyle. They can't socialize as much because they're afraid that they're going to wet themselves.
Right.
And, it's not their fault.
Pretty stressful,
It's not their fault. They've had children. Things have changed in their bodies, but no one has really addressed this, earlier on, and now they're starting to see the results. But we want to kind of relay the message that it's not too late. This is not normal as you age for women to have incontinence.
You shouldn't just accept it and hide it and be, shamed by it.
Exactly. There is help out there. And even if you have tried to get help and it hasn't necessarily worked, maybe you need a different type of approach. And that's where we can help, and I don't want to say just women, because men actually suffer from that too.
Sure.
Majority of them are women. But, there's help out there. We can take a different approach on it, and we've helped a lot of patients. And then last but not least, with all of these patients, from everything from low back, pelvic to hip pain, one of the biggest things that they can't do is they can't sit anymore. And that's a tragedy.
It is a problem in this day and age where we sit on our butts an awful lot.
Exactly. Our nation, we sit on our butts all day long. And if you can't do that, it's a problem.
Right.
And so, it's sad because some of all they want to do, some of these people, is go to work and concentrate and do what they love to do.
Right.
And they want to sit and have dinner with their families or play with their children or go for a nice bike ride. And they can't do that anymore.
Right.
And
it's just uncomfortable.
Yeah. And it's sad because often people are told, well, don't ride a bike anymore.
Right, exactly. Just get rid of the thing.
Get rid of it. And they're just like, wow, well, I need to do that.
There's an old joke that says, doctor, it hurts when I go like this. And it said, well, just stop going like this.
Exactly.
Thank you.
Yeah. So, our philosophy is we don't believe in that. We want to get you back to a healthier lifestyle. We want to get you back doing the things that you're passionate about, doing the things that you love. And that's our goal. And
excellent.
Yeah.
Well, I can tell we're going to have some really interesting conversation moving forward. So tell me a little bit about how you came to all this. I mean, again, this is not a well-known thing. So how did you, stumble into these different specialties?
So if you asked me when I was 5 years old what I wanted to be, I would not be saying this is what I wanted to do with my life.
Pelvic floor.
Pelvic floor. Like who grows up saying that that's what they're going to be doing? But what it was is, I went to University of Florida, go Gators, so all you Gator fans out there. And I went to University of St. Augustine, which was where I got my master's in physical therapy. And that school paved the way for me to basically, it's a manual therapy school, and all that means is you utilize your hands to evaluate and treat problems that occur within the body.
Okay.
And that kind of paved the way for me to really specialize in spinal dysfunction and work with a lot of these patients that had spinal pain. And I needed to leave the house. My mom was doing my laundry and, she was feeding me dinner. And
time to get out of the nest.
And it was great. And I loved every minute of it. But I was like, I think I need to grow up. So I moved to the biggest city possible. I moved to New York City. I loved every minute of it. I worked in an amazing clinic. And I quickly became the person that everyone went to treat spine issues, low back pain, sacroiliac joint pain. And I was able to get a lot of patients better, but there was this subgroup of patients that, I was able to get them 75%. I was able to get them 60%. I was able to get them 90%. But there was something else that was missing. And that missing piece I knew had to do with the pelvis and the pelvic floor. And so I decided at some point I was just going to start, educating myself in every aspect and figure out what that missing link or that missing piece was.
I guess even intuitively it makes sense. I mean, it's what everything hooks in basically to your pelvic floor, right?
Exactly.
I mean, it is your core. It is your root.
It is part of the core. It's a huge part of your core, and people don't realize that. And that can actually be one of the big factors that maybe prevents people from improving even more once they hit a plateau in progress. And so that has a lot to do with why maybe problems continuously happen.
So you got drawn into this subgroup of patients because they were kind of a conundrum. You were trying you wanted to solve the mystery.
Yes, it was like...
And so you dug deeper.
So I dug deeper, and and I thought to myself, I'm like, this is such a small area. Like, I just need to take 1 or 2 courses and I'll be able to treat these patients. Well, I'll tell you, it's pretty much taken over my entire profession. 40 courses later, giving lectures to almost every single healthcare system on this topic, educating myself constantly through, my patients as well as through my colleagues, and I'm still learning. And it's amazing. We're having amazing results with these patients, but there's so much more to learn. And now, if you ask me, what do you want to do when you grow up? I am so glad that this is what I'm doing, because I just see the difference that we're making in people's lifestyles, and it's great.
Well, if you keep getting out there and speaking and educating people, maybe there will be some 5-year-old that says, I want to be a pelvic floor specialist.
Actually, I do have some patients.
And their parents will be like, huh?
I do have
Not an astronaut?
Right. I do have some patients that, they'll bring their kids in and they'll say, ooh, I kind of want to do what Hina does. And I'm like, wow, I'm actually having an impact on little kids. This is awesome.
There you go. You're inspiring people.
I'm inspiring people. So.
Well, I'm so glad you're going to be part of Mainline Healthy Living, because, again, this is stuff that needs to kind of be explored and put out there in the public. You're out there speaking in health systems, but people need to know. So hopefully they'll be tuning into our website and our social media stuff and learning an awful lot about where these mysterious pains that they seem to kind of get shuttled from one doctor to another and get no answers might really be coming from. So to be continued with lots more interesting topics and themes. Join us as Hina joins us as a regular feature of Mainline Healthy Living. So until next time. See you soon.
Great. Thank you.